Hello, I am Vivian Fregoso, and we are in week 2 of our second part of Anatomy and Physiology, part 2. We're actually learning about the cardiovascular system. So today I'm going to be dissecting a sheep's heart, and then I'm going to also go over diagnosis that is related to the cardiovascular system. So I'm going to go ahead and get started. This is our heart here. So I kind of flipped it over for you. So this is what this one would be. This side right here would be the right side. This would be the left. So this right side here would be our right atrium area. And then this one here would be our left atrium. So I already cut the heart in half. So just for presentation purposes. So I'm going to go ahead and open it up. And you see here all these wonderful things. So up here, you can definitely see our aorta. It is this area right here. You can see our, it's divided. Each side is divided up by right side and left side. I mean, this is our right, this is our left. So on our right side here, you're going to see the auricle of the right atrium, and it is right in this area. And you'll see some fatty parts here. That's the adipose tissue. We have our tricuspid valve right in this area right here. We have our right ventricle area here. You see these little kind of like hairline things right here. That is our chordae tendineae. Look like tendons, which I believe that's what it is. We have our apex, which is the lower part of our heart here. We have our papillary muscle, which is this area, kind of right here. And there's also different layers of the heart. The heart is a muscle, so you'll see there are different layers kind of that we cut through. You can kind of see them a little bit here. So we have the endocardium, the myocardium here, and then we have the epicardium, which is the outer, kind of almost the outer layer of this, kind of surface of the heart. And going on our left side here, we have our pulmonary trunk. You'll see the little hole right here. So you'll see the auricle of our left atrium right here in this area. We have our bicuspid, which is our mitral valve here in this area. We have our left ventricle, which is right in this area. And you have our myocardium area in this area right here. So we have our superior vena cava, and that's kind of in this area right here. You can kind of see that I put my probe through it. And this is our heart. So a diagnosis that I want to talk about is a dysrhythmia, which is our atrial fibrillation. That's a big one in my family. We have a lot of people in our family that do have that diagnosis. With that diagnosis, you will definitely experience, most likely tachycardia when you do have an episode of atrial fibrillation. And with tachycardia, you'll have shortness of breath, you can pass out. It gives you a higher chance of getting a stroke. The way to treat the atrial fibrillation is with medication. A lot of the times they do give you blood thinners, and then they give you other medications as well to regulate your heart rate as well as your blood pressure. Some of those medications are Pradaxa, digoxin, and then any other medications, dilatazem, which is a cardizem, that's a big one too, especially for your heart rate. And then other medications just to help regulate your blood pressure. It's very important to help regulate your stress level. I know that stress can cause you to go into an episode of atrial fibrillation. A lot of the times how you notice it is if you're taking a patient's blood pressure and you put the pulse oximeter on their finger, and you kind of notice that their heart rate goes from super high to super low, or high low, or low high, or just kind of a irregular heart rate, and it's definitely alarming. You can let your doctor know. They can do further testing. We could do an EKG to see if they're in atrial fibrillation. So that is a big diagnosis for me. I do love learning about the cardiovascular system. A lot of heart related issues do run in my family. So I hope this was a quick, dissection of the sheep heart. I do hope that you learn, well, we all learned something from this chapter, and we'll see you again next week. Thank you.